Hello, this is Dr. Dale again. This video is alphabetic list of problems on letter M. Today I'm going to talk about a metabolic caused acid-base disturbance, which interpreted as metabolic acidosis or metabolic alkalosis. Actually, these two terms really medical oriented. It's really the communications between the professional, between the physicians, the doctors and the nurses, and the lab person about this acidosis or alkalosis. In terms of patient, what kind of knowledge that will help patient to recognize this is a serious condition. Usually this kind of acidosis is associated with quite a serious problem. So having talked about that, let me just bring up the emergency situation associated with this acidosis or alkalosis, metabolic cause. Are there any emergency situation that warrant a visit to physician as soon as possible? Yes, actually it is quite dangerous. Depends on the causes. Usually the metabolic causes are because either over-digest or lost through the digestive system or the kidney problem. So basically take overdose or extra amount of acid, for example aspirin, or due to the severe long-lasting diarrhea, lost bicarbs. Of course the bicarbs is alkalic, or vomiting. So this is the second or the third cause is kidney problem. So associated with these three causes, on top of that, if the patient had a long-term diarrhea or vomiting and developed a weird kind of breathing, deep and slow, it's not gasping air, but deep and slow, or patient realized just took too much aspirin in one time or cumulative doses beyond the prescription medication. For example, somebody had arthritis, not managed by the prescription medication and just took some aspirin, continues to take, or chronic accumulated may cause this metabolic acidosis. Depends on of course the kidney function. And the third cause is the kidney disease. So on top of these three risk factors, and the patient developed the weirdest breathing I talked, alter the mental status, or basically this is the symptoms, not quite emergency unless, like I said, acute. The other cause diabetes has acute alter the mental status with the breathe, smell like a fruit. So like a ketoacidosis. So these are the causes, and some of them are quite urgent. If digest a huge amount of aspirin at one time, I think you probably heard of it, or has a chronic kidney disease, suddenly develop this altered mental status, could be the acidosis, or diabetic patient suddenly develop this altered mental status with different like a weird breathing and breathe out like fruit taste, smell like fruit. If that's the case, then it's really go to the medical emergency as soon as possible. Usually quite subtle for a normal person without ingest a huge amount of acid chemicals, or without long-term without chronic diseases. Usually it's not an emergency. It's quite serious, but the symptoms is subtle. However, it is an emergency because need to be corrected as soon as possible. Even though you're normal, but you have prolonged diarrhea or vomiting, so that the disturbed acid-base balance, like I said, the symptoms could be subtle. You could not feel it unless suddenly collapse. So it is an emergency. Anyway, so talk about this. Let me just explain a little bit of this. What is this metabolic caused acid-base disturbance? In other words, metabolic acidosis or metabolic alkalosis. Basically, non-respiratory cause, because in the body we have two organs to regulate two important organs to regulate this acid-base balance. One is through the lung, because breathing out the carbon dioxide, which is acid, and the kidney really can absorb iron, hydrogen ion, or excrete hydrogen ion to balance. So for the normal person with normal respiratory system, with normal kidney, it won't have this acid-base disturbance unless from exogenous take too much acid at one time, or accumulate from chronic take acidosis, or the long time nausea, vomiting, or diarrhea. So it is really a medical term for the patient. I just explained to you the metabolic acidosis, for example, what it really means. It means non-respiratory cause, extra acid in the body. The etiology for this metabolic acidosis is from the diarrhea, because diarrhea in the small intestine contain a rich amount of bicarb, which is alkalic. And also the kidney disease also can cause the acidosis, loss of function to excrete hydrogen. So these two factors, risk factors, from the endogenous causes can cause this acidosis, either from lost base or from fail to excrete hydrogen. So that's just the fundamental mechanism. Easy to make sense. However, who are at risk for this metabolic acidosis? Like I mentioned, the long-time diarrhea, chronic diarrhea is one. Or patient has cancer, for example, after surgery, so have the little opening through the skin. That's another cause. Lose the fluid from the intestine, or the kidney conditions, a chronic kidney disease. So these three causes are really quite common. Or the other ones, like I said, from the exogenous intake of the acid, chronic or acute, or diabetes has suddenly changed the activity and developed this acidosis, ketoacidosis. So these are the quite common 4 causes for the metabolic acidosis. As you can see from what I just mentioned, they occurred with chronic conditions. And on the other hand, the metabolic alkalosis is just opposite from this. You lose the acid solution from vomiting, chronic vomiting, because in the stomach has a huge amount of hydrogen chloride, which is very acidic. pH is 2, which means very, very acidic. So if you keep vomiting, then you lose this acid, then cause metabolic alkalosis, or the kidney has problem, lose the iron. Usually it's not quite common, lose the hydrogen. So this is just fundamental. I brought here the terminology for the patient probably, because this is really medical term, metabolic acidosis and metabolic alkalosis. Usually these are just the presentations of other systemic disease, of course. So it's not just a single diagnosis, because if this kind of metabolic acidosis or metabolic alkalosis usually has another etiology, systemic causes, so then this is just one of the diagnoses of associated other diseases. So I hope it is I explained clearly, but if it's not, at least I brought a term here, and if you're interested, if you're particularly if you're those patient population who might have risk to develop this, then search more so you know what kind of signs you're looking for, at what stage of your disease might have this kind of problem. And for those healthy people, just make sure if you have chronic vomiting, diarrhea, you just need to know to make sure that there's no serious complications like this metabolic acid-base disturbance to occur. So this is a video longer than I expected. Still just touch very, very superficial, because this is such a big concept to talk in terms of mechanism, in terms of explanation. But I just hope broad term out. So if you're interested, you can search more. I thank you for watching. I will see you next time.